Reality bites. Refrigerated trucks outside a Manhattan hospital to store bodies because the morgue is full, under the gaze of the Empire State Building. On the street, signs that people realise it's serious. New Yorkers now wear masks and gloves in public. Soldiers are deployed to help. Extraordinary times, and even aid from unusual places.
I love that expression. You go to war with what you have, not what you need, right? We're not at the apex, so we're still in the stage where we have the luxury, if you will, of gathering as much as we can. So the 1,000 ventilators, and from China, and the 140 from Oregon, and we're still shopping.
The rest of the United States is watching. New Orleans has opened a medical support facility and a convention centre to ease the strain on local hospitals. It'll take COVID patients too sick to be at home, but who don't need intensive care.
Right now, as is being accurately reported, New Orleans, that region, Orleans, Jefferson parishes, that's the biggest hotspot. That's where we're most likely to exceed our capacity to deliver health care the soonest, and so that's where we're working.
The pandemic is not only spreading fear, it's also awakening gratitude for those risking their health for others.
Oh, it's nice. It's really nice. Yeah, give us hope.
I'm now joined by DW's Pablo Foley-Elias. Pablo, you've had experience covering this administration, having only just arrived from being our correspondent in Washington. President Trump has said that there are going to be a lot of deaths. What do you make of that strategy?
Well, it's, you know, if you follow President Trump quite closely, it's often quite hard to follow him because his strategy is at times very difficult to follow, you know, and particularly with this situation here, we've seen him contradict himself often. He's gone against what actually the health officials have been saying, and often in these long press conferences that he's been holding, it's been at times very confusing for the American public to really see what the strategy is. I think before we get into any greater detail, though, we should really listen to what President Trump had to say in his last appearance in front of the American public. So let's take a look. Sure.
This will be probably the toughest week between this week and next week. And there'll be a lot of death, unfortunately, but a lot less death than if this wasn't done. But there will be death. We're looking for an obvious focus in the hardest hit regions. Some of them are obvious and some aren't so obvious. They spring up, they come, and they hit you like you got hit by a club.
Well, I mean, you know, it's very strong what he's saying there. You know, he's warning Americans that, you know, there are going to be a lot of deaths, that they should expect this in the coming days and weeks. But also one thing that's quite interesting from President Trump is that the economy, which is very important for President Trump, let's not forget, has been sort of always present in when he's been speaking to the public. And he sort of even said in the press conference that he wants Americans essentially to get back to work as soon as possible. But of course, we know that this is not going to end in the next few days or weeks. And that's also a message that's being sent out to people. It's confusing as well. He's saying to people as well to use a malaria drug, which, you know, his health officials have been saying, hang on, this is all anecdotal. Let's not be using this. Also, he's been saying he's not going to use a mask himself, even though saying that it is actually something that's, you know, good for people to use. So very confusing, very hard to follow really what the strategy is.
In the meantime, of course, in the United States, there's a lot of talk about there not being some sort of federal guideline about how to approach this coronavirus. The federal government leaving it up to the states. How are Trump's actions, his behavior during this, affecting the strategy of individual states?
Well, like I was saying, it's very hard to follow the strategy. And it's, you know, if you look at some states, which in particular in the southern states, Republican states, will say, I'm just going to name a few of them, Alabama, Arkansas, Mississippi, 3 states which, you know, are very poor compared to other states such as New York and Washington State and California. New York obviously has huge numbers of infections. You know, these are areas which are being very lax about this. And, you know, there's been a lot of criticism saying, why are you taking this approach? They haven't really forced people to take any serious measures. And could it be because of President Trump and the messages that have been sent out?
Got it. Pablo Foley-Elias in our studio with us. Thank you so much.